Good morning. Welcome, everybody. My name is Professor Rachel Porter, and today we're going to discuss one of the foundational skills you'll be using throughout nursing school and your nursing career, understanding medical abbreviations and terminology. As LPN students, you'll quickly discover that healthcare professionals communicate using a specialized language. Medical abbreviations help providers communicate efficiently, document patient care, and share information across healthcare settings. By the end of this recording, you'll have a better understanding of common abbreviations, how to interpret them correctly, and how to avoid dangerous mistakes. In essence, medical abbreviations are a form of shorthand to help tell the patient's story. Why abbreviations matter. Medical abbreviations matter because healthcare is fast-paced. Nurses, physicians, therapists, and other healthcare professionals often need to communicate quickly and accurately. Abbreviations improve efficiency by reducing the amount of time needed for charting and documentation. They facilitate communication among members of the healthcare team and help standardize documentation across departments and facilities. However, medical abbreviations are only useful if everyone understands them correctly. One of the themes you'll hear repeatedly throughout nursing school is patient safety. While abbreviations save time, they can also create confusion if used inappropriately. Knowing which abbreviations are appropriate and which should never be used is an important nursing responsibility. Before we go any further, let's distinguish between an abbreviation and an acronym. An abbreviation is simply a shortened form of the word or phrase. For example, VOL stands for volume. An acronym is formed from the letters of the first series of words. For example, CBC stands for complete blood count. In healthcare, you'll encounter both constantly. Whether you're reading patient records, medication orders, or laboratory results, you'll need to recognize and understand these terms quickly. Let's look at some common abbreviations you'll encounter during clinicals and in practice. You may see location abbreviations such as ED for emergency department or ICU for intensive care. Patient condition abbreviations also include ANO, meaning alert and oriented, and VSS, meaning vital signs standard. Laboratory abbreviations such as CBC, BUN, and H&H are frequently used when discussing patient status. Frequent abbreviations such as BID, TID, PRN, and STAT also appear regularly in medication administration. You'll also need to recognize anatomical abbreviations like RLQ and LLQ, as well as measurement abbreviations such as MG, ML, KG, and MCG. Don't worry if you don't know what those are today. Mastery develops over time through repetition and through exposure in clinical practices. One challenge with abbreviations is that multiple abbreviations may have multiple meanings. For example, PPD could stand for postpartum depression or purified protein derivative as used in tuberculosis testing, or packs per day when documenting a smoking history. This is why nurses always must consider the clinical context in which the abbreviation is being used. The patient's diagnosis, location, age, and reason for treatment often help determine the correct meaning. Another example is ED. Many of you immediately think of emergency department. However, ED can also refer to eating disorder, education, or erectile dysfunction. Imagine documenting care incorrectly because you assumed the wrong meaning. This could lead to misunderstanding and potentially affect patient care. Always verify the meaning based on the clinical situation and the context in which it's used. TX is another abbreviation with several possible meanings, including treatment, therapy, transfusion, transplant, transfer, and traction. As future nurses, never hesitate to ask for clarification. Patient safety is always more important than appearing knowledgeable. If you're unsure about an abbreviation, verify it before acting on anything. Some abbreviations have been identified as unsafe because they're commonly misread and contribute to medication errors. For example, QD for daily and QOD for every other day can easily be confusing. A missing or misplaced decimal point can change your medical dose dramatically. To reduce errors, healthcare organizations follow guidelines from the Joint Commission and encourage providers to write out these instructions completely. As students, developing a safe documentation habits now will benefit you throughout your career. The heading on this slide is actually a link that will take you to the Joint Commission's list of do not use abbreviations. Additional dangerous abbreviations include U for units, which can be mistaken for a zero or the number four. U may be confused with IV. MS can mean morphine sulfate or mag sulfate. Similarly, MSO4 and MGSO4 may be confused with one another. Medication administration is one of the most critical nursing responsibilities. Small documentation errors can have significant consequences. Therefore, many facilities require these terms to be written out completely. Here's a practice worksheet for you. Let's put our knowledge into practice. Healthcare terminology is learned best through use and repetition. As we work through these examples, focus on translating abbreviations into the complete clinical language. Click on the link, download and print out and complete the medical terminology. The answer key will be posted in this Moodle site. Okay, here's a practice one for you. A 72-year-old male admitted to the CCU HX of CHF and HTN. Patient reports worsening SOB times 3 days, VS stable, ordered Lasix 40 mg IV stat, monitor INO Q4H, lab increase BUN/CR. What does that mean? Take a few minutes and write out what you believe this is trying to say, and then we'll go over the answer key in just a few minutes. Feel free to go ahead and pause this video and do that now. What'd you come up with? Here's the answer key. A 72-year-old male admitted to the critical care unit, history of congestive heart failure and hypertension. Patient reports worsening, shortness of breath for 3 days. Vital signs are stable. Ordered Lasix, which is a diuretic medication, 40 milligrams intravenously immediately. Monitor intake and output every 4 hours. Lab results show increased blood urea, nitrogen, and creatinine. How'd you do? Hopefully you got at least some of those. Here's another practice one. Go ahead and pause and take a few minutes and see what you can come up with. Feel free to use the previous slides as a reference if you need to. How'd you do? This slide introduces abbreviations commonly seen in surgical and medical surgical settings, such as post-op, NPO, nothing by mouth, ADLs, which are activities of daily living, and PRN, which is as needed. Hopefully you did well. As nurses, it's not enough to know what these abbreviations mean. You must understand their implications for patient care. For example, knowing a patient is NPO directly affects your care in planning and in medical administration. Does that mean that you need to hold their meds because they're nothing by mouth? Or are they allowed enough water to get their medications in? Good questions, right? And how would you know? You would ask. Okay. Sorry for the scrolling. These are some fill in the blanks that go along with medical terminology. I'm not sure if they're supposed to be in this PowerPoint, but you can go through these if you choose to. In conclusion, I want you guys to remember that no one begins nursing school already fluent in medical language. Learning medical terminology and abbreviations is a skill, and it's a process that takes time in um, practice to develop it. Your goal is not to memorize every abbreviation immediately. Instead, you want to focus on becoming comfortable with common terms, using resources appropriately, and additionally knowing where to find your resources. And always prioritize patient safety when documenting and communication are involved. We're excited to have you join our LPN program. You'll learn a tremendous amount over the coming months, and today's discussion is just the beginning of your professional language journey. Welcome to the program, and we look forward to helping you become safe, knowledgeable, and compassionate nurses.